Hello, and welcome to the Center for Advancing Health Systems Innovations, CAdHSI Podcast. My name is Dawn Cooper Barnes, and I am Communications Director for CAdHSI. In Episode 1, we explored the founding vision, key challenges, and early successes of CAdHSI. Today, we build on that by diving into the leadership and strategic backbone that move this organization forward by speaking with someone who has played a strategic and critical role in moving the organization forward, Nicola Dyer. Hi, Nicola, and welcome to CAdHSI.
Hi, Dawn. It's wonderful to be here. Thank you so much.
Well, you're a part of CAdHSI. I should say welcome to the podcast because you have been a driving force in CAdHSI for some time. But go ahead and tell us about yourself, your background, anything you would like to share, and tell us what brought you to CAdHSI.
It's a long story.
It's okay.
I'll do the medium version. So I'm an economist by training and spent years doing international economic development at the World Bank, spent many of those years working in and on Africa. I opened the World Bank's office in Gabon and also managed the office in Ghana. I've been to many countries in Africa, I think about 30. One of them is not yet Liberia. So still have, and I've been to almost all the countries in West Africa, actually. So Liberia and Guinea are still on my list. I am fascinated by interdisciplinary and transdisciplinary work. This is one of the lessons that I've learned from my work in international economic development, that everything's connected. And if you try to work on something in isolation, you might make some headway, but you're going to go a lot farther if you're able to identify those connections and build on them. And so this is what has drawn me to CAdHSI. I did retire from the World Bank in 2019. I didn't retire from working life. I actually have been working on seaweed since then. And there's a tie-in to CAdHSI somewhat because seaweed has knock-on health effects as well, amongst other things, nutrition. So I've been with something called the Global Seaweed Coalition. But I'm somebody who likes to give back. So during the pandemic, I mentored many people. One of those was a young man named Ambalai Johnson. Ambalai reached out to me, and we began to have this mentoring conversation. And during that, he shared with me that or after that, I don't actually remember, he shared that he wanted to start this wonderful initiative. And so we had conversations about that. And then at some point he asked me, did I want to join the board? And since I was a little bit overloaded at that point, I did hesitate, but he can be quite persuasive, Ambalai.
He sure can.
He sure can. And so he did persuade me to join. And I've been very glad to be able to do that. So that's the medium-ish version.
Well, that is fascinating. All of it is fascinating. Any of it would be something I would want to hear more of. But let's dive into your role as vice chair. What inspired you to push Ambalai and the leadership team to define CAdHSI's unique value proposition, and why was that so important at the outset of the organization?
I think that's a great question because there's so many groups, initiatives, et cetera, out there who they know they're doing something good, and so they're pushing to do their thing. But there are so many groups out there. So in order to be able to distinguish itself, CAdHSI really needs to focus on, well, what's that unique thing that only we bring? What is our unique value proposition? What's the value that we add that no one else can do? And that's what I focused on. It's a lesson that I learned from my own work in international development. I used to manage a wonderful program called the Global Agriculture and Food Security Program, an acronym that is slightly worse than CAdHSI's, because GAFSP, CAdHSI,
goodness.
They rival each other. And In the space of agriculture and food security, there are many initiatives, and we at the CAdHSI really needed to focus on what was our unique value proposition. And there were some very good lessons from that I brought into the conversations on CAdHSI. Because initially there was a lot of ambition, there wasn't a lot of focus. And to be able to get to impact, and I'm also all about impact, you need to have focus.
That was very well put. And I think anyone in any field can learn from the process. How do you see our proposal development process evolving as we grow?
So for that, I think it's really learning by doing what works. I'm a big believer in, yes, try, set yourself some objectives, do it, see what happens. Do you get the result that you wanted? Okay, do more of that. Do you get a different result? Why? Were you doing the right thing and it was just external circumstances? Or did you maybe need to revamp, in this case, the proposal process? Is there something that's missing? Is there a kind of expertise that should be brought in? Is there part of a process that's missing? And so continuous learning is really important.
Right. And I get it. I think that is going to be paramount in shaping the future, knowing what has worked for us or knowing why something has worked better or not as well. So yeah, all good points. How have you and the board worked together to ensure our governance documents like the bylaws, the Constitution, articles of incorporation are well aligned to support our strategic goals?
Well, I'm not sure if the other board members would agree, but I've sometimes felt like I was the one going, hey, wait a second, let's back up here. It's important. I have worked on international partnerships. I've actually attended a seminar series by a good friend of mine who has written the book on international partnerships. She's actually written 2 books. If I can make a plug for her 2 books,
sure.
Andrea Stumpf.
Nice.
Excellent, really, really good books. She has a lot of experience in this, and I've learned a lot from her and from her experience in this. And one of the images that she uses, it's a very powerful one, is if you're building something, think of it like an architect would. Build the foundation first. If you try to put a roof on something that doesn't have a strong foundation or even walls, then you're not going to get very far. So it may be boring, but the foundation is really important. And when I say boring, the foundational documents, ensuring that the bylaws are solid, ensuring that the procedures of the entity, that they actually are designed to work in favor of, again, of the desired outcomes, of the impact that CAdHSI wants. So getting that right from the outset. And because we're here in the US, we also need to get it right because
for legal reasons.
CAdHSI is a 501c3.
Yes.
Need to get it right for exactly as you say, because it's the law. And in some countries, there's, shall we say, more flexibility. Mm-hmm. In this one, there's, shall we say, less flexibility, which is, for something like this, when it comes to ultimately, there's a hope that CAdHSI will be managing other people's money in order to achieve outcomes. Got to be accountable to those people. How to be accountable if we don't know how the money's been spent, for instance. So having good systems to track the funds coming in, to track the way that they've been used, to track the outcomes that they're generating, to be able to communicate the outcomes that they're generating. All of that is really important. And of course, we also need to manage. I spent 8 years being the conflict of interest guru at the World Bank. We also need to manage.
Helpful information to have.
Isn't it?
Mm-hmm.
We need to manage conflicts of interest. And when I say manage the risks associated with them. Sometimes conflicts of interest, all they need is just discuss it, and that's it. And sometimes a conflict of interest is so serious that we say, well, this is going to present such a risk to CAdHSI that maybe we shouldn't do it that way. So we need to have a good policy in place for something like conflicts of interest.
CAdHSI is very fortunate to have a person with your experience, and I can see how Amberly has been well mentored. Let's move on to talking about translating research into practice. So from your governance perspective, how do you ensure that our research efforts connect to our larger strategic goals, especially as someone who has had all this experience with advising NGOs and startups and translating research into actionable items.
Thank you. I think that the important thing is always to focus on what's the goal, what's the desired impact. So keep asking the question, why? If we say, let's do this, why? To what end? And if we can keep answering that question, then we can keep digging deeper. So working backwards from the impact to what we're doing, I think that's really important. And keep asking, why are we doing this? Are we doing this because somebody wants to do it, because they're excited? Which is often the case in research. It's exciting to pursue an avenue of research because it's intellectually stimulating, but it might not lead to something practical. So it's got to be linked to practical outcomes. And there, I think it's important to bring both the research perspective and the perspectives of a broader set of stakeholders. And based on my work, that broader set of stakeholders has to include the folks who are ultimately going to be affected by the work. So in some circles, those are called beneficiaries. For me, that's not the way that I like to think about those stakeholders. I like to think of them as people who are affected, people who are involved. Stakeholders, for me, is a better way to describe them. And when I say better, it puts them on the same footing as everybody else. Instead of, well, we're the smart people coming in to do something, no aspersions cast on my many colleagues in the world of international development, but there's a constant struggle between being an expert and therefore knowing exactly how to do something, and being an expert and listening to the people who you have in front of you, who also know what their issues are and have thought about it. They might need new perspectives, but let's respect them and their lived experience.
Well, and so, yes, I totally like the word stakeholders. I don't know who first started using it, but I think it works.
Doesn't it?
Because it means that everyone at the table knows the role that they play and knows what they stand to benefit from or how they stand to benefit from it. How do you think our governance and board oversight can better support the technical teams as we move forward and grow?
I think it's really important for governance to be just that, like not to get involved in the weeds, but rather to help with the strategy. It's Ambalai and the leadership team that proposes the strategy. We on the board obviously can help with that, but I don't think it's up to us to come up with it. So because I think that's disempowering.
Yes.
I think it's really important that the leadership team come up with it, and then we support asking critical questions, asking, have you thought about that? Or what about this? And so that's one. Providing solid monitoring and oversight, not to be heavy-handed, but in that spirit of, is this working as expected? And being that helpful and constructive party that comes in that's not caught up in the day-to-day and not so focused on, well, I'm doing this because I'm supposed to do this, but rather, okay, how is this on track? So helping to set up systems. I'm a big believer in systems. Set up the systems so you don't have to keep reinventing the wheel, and then use your systems to help you to ensure that you're getting where you wanted to get.
Exactly. Well, it seems like what you're saying is that there are various skill sets that are all needed and they need to work in concert. And it needs to be where the scientifics are doing their research, but the governance is overseeing in a way that makes the whole group holistic. So, yeah.
Well put.
Well, I think that is so exciting. How do you see our partnerships with institutions, let's say government ministries and the private sector, helping to sustain and grow our innovations in the future?
In today's world, we have to work in partnership. We have to collaborate with others. That's how we're going to generate that impact. Because if we, you know the proverb, if you want to do it fast, you go it alone. If you want to go far, you go together. You do things together. And that way you bring in those competencies, that experience that you don't have within CAdHSI. And we enrich also the experience for our partners because CAdHSI brings something, that unique value proposition. So it makes it special on both sides. I view partnerships often as walking a journey together. So walking on a path together. And the path image is you're doing it because you want to get to a specific kind of goal. You're focused on a mission and you believe that you can get there faster and better and more sustainably together than both of you or all of you doing this apart. So bringing the partners together in support of that one overarching goal, that's really exciting when you're able to get that done.
Well, we've been particularly fortunate at CAdHSI that we've had some partnerships already, like those with Johns Hopkins and with Harvard. How have they helped to enhance CAdHSI?
Oh, these are premier academic institutions. And this is part of CAdHSI's unique value proposition. It's really highly well-trained academics who also have a burning desire to make a difference on the ground. So bringing the academic heft of these institutions, that's important. Not just anybody could do that. And that is a credit to CAdHSI's leadership.
So talk a little bit more about value proposition, because that intrigues me. How do you see CAdHSI's value proposition?
I've been watching it evolve and have been encouraging focus. Right now, I see CAdHSI's value proposition as very much focused on Liberia and potentially very targeted disenfranchised or marginalized areas or marginalized groups who need an improved version of public health that they're not getting from their government or from their environments. And that's something that with this combination of academic firepower and I would say growing experience on the ground, because the experience on the ground is really important, the knowing how to put together a project on the ground. So being able to identify from impact back to, desired impact and outcomes, back to the desired outputs that are expected to help achieve that, back to what are the inputs that are needed for that. Being able to do that kind of results chain analysis. And that I think CAdHSI has made a lot of progress towards getting there. I've seen huge progress over the 2 years.
That's good to know. And it could be very satisfying, couldn't it? I mean, partners might find that it's very satisfying at the end of the day because the impact is so immediate.
It is. And most people want to be able to do good and see good done. They want to see people doing better as a result of what they've done. It makes you feel good. Mm-hmm. And so if CAdHSI can be a vehicle towards that, and in a country like Liberia, that direct knowledge of the institutional environment is critical. Coming into Liberia cold, I worked on Liberia when I was at the World Bank. I did not have the opportunity to go, but I worked on it right as the war was ending. Mm-hmm. And so this was a pretty critical time. Mm-hmm. And, if I have many takeaways from that time, but one is surely that this is a very complex institutional environment, and you've got to understand it in order to be able to make a difference. You can't just come in and say, let's build bridges. Okay, you might have a couple of bridges and they might last a few rainy seasons, maybe. But you've got to work with the people on the ground. You've got to work with the institutions, with the partners, and again, with the stakeholders. So with Ambalai and with some other Liberians who I've been in touch with, seeing how very committed librarians are tackling some of the challenging governance issues like corruption, for instance, because that's hard. Corruption just eats away at everything. So having a group like CAdHSI, it's one of the reasons, going back to the systems, if we can build CAdHSI in a way that it is really robust to issues of, say, corruption, that's going to help it to achieve better results on the ground. And that is going to attract
leave a
partners.
legacy
Exactly.
that will attract. And again, it goes back to your whole concept of the foundation needs to be there.
Exactly.
If we don't have the right foundation, if we don't know what our value really is, how can we proceed?
Yep.
I'm learning so much today. I hope the rest of you are learning something, because I think this is a fascinating conversation. From a proposal writing angle, how do partnerships strengthen our case when we're seeking funding? You touched on it, but you can delve into it more.
Yeah. Well, I think that funders are looking now for more and more for actors who have that openness to working in partnership, because there's been a lesson learned globally that working together helps you to achieve more. It also helps to eliminate duplication, and instead of fighting over turf, work together to achieve the outcome. So I think the funders are much more attracted to a group that is ready to work in partnership with others, because they know there's likely to be a much better outcome, and that the focus is going to be on that outcome and not so much on, well, mine. This is mine.
Yes. That makes perfect sense. What do you look for in a partner? We can talk about what CAdHSI should be looking for in a partner, but just in general, how does one determine that this is a good fit?
Often it's that feeling, and often it's personal relationships. I've done a lot of partnership work. I think it's starting with, how can I be a good partner? This was my starting point, is thinking about what matters to the partner. Why should they be interested in working with the initiative that I'm proposing they work on? Is it just because I want something of theirs? If it's just that, then I put myself in the partner's shoes and I go, maybe not. They just want something from me. But if it's something that's going to be mutually beneficial, if by working together we can both benefit, and part of the benefit is seeing that great result on the ground, part of the benefit could also be everybody is making a profit. Nothing wrong with making a profit. That's a good thing. For a nonprofit like CAdHSI, the profits would be, the funds would be plowed back into CAdHSI to help it to do more good. But in general, you want to be able to get good outcomes. So maybe it's recognition. Maybe it's additional funding coming in. And so it starts with me as, am I a good partner? And then I look for partners who also are, I use the expression, willing to play nice in the sandbox. You're going to be mutually complimenting each other. You'll do things for each other. You might, it could be as simple as reposting systematically. This is what we do in the seaweed work that I do. We repost each other's work systematically. That's what we do for our partners. We suggest that if we meet somebody who is an interesting person, we say, well, that's great. We'd love to work with you. And you know what? You might enjoy talking with this group as well, because it sounds like what you want to do might be of mutual interest to the two of you to talk. So, not being fully selfish, being a bit selfless, I think is really important in a partnership, and being able to be honest with each other when needed, to be able to sit down and have that conversation. Whoa, I'm sorry, I did not mean to do that. Or, don't know if you realize that, but this was this is what happened after you did X. So being able to have those conversations is important as well.
Well, those all make sense, playing nicely. I mean, I suppose there's adjustments that can be made on either side, but if you start off with good chemistry, it should go a long way to making the partnership work. So we've covered an awful lot. What governance innovations or shifts do you think will be key as we move forward in positioning CAdHSI to be at the forefront of the future of health systems?
So there's governance innovations and there's innovations. And I think I want to speak maybe to both. Governance innovations, I think we actually need to stay with the tried and true, at least as a startup. Get some really solid assignments done, be able to report on those in perhaps there might be a unique communications format to do that, but get the word out. But then on the innovations front, I think that there it's wide open, and I think AI will make a big difference. Yep, AI and its medical applications in Africa, in particular, in other settings as well. But I think in Africa, I was inspired actually by a woman. So I chair a grant program also. So I'm a little busy.
You wear many hats.
That's what retirement has allowed me to do. Put on all the hats I want to put on, instead of the hats that I've had to put on.
Yes.
So it's
the choice is what makes it interesting.
Exactly. So this is a program called Margaret McNamara Education Grants, and I chair the South Africa program. And one of our grantees really is doing some really interesting work on using AI in the context of helping to improve maternal mortality. Really important in contexts where they're not necessarily going to be able to have access to solid technology. They're not going to have access to the best facilities. So I think that AI can make a big difference and I have no doubt that this team can harness that, because this is a very smart team. So being able to do that and do what Africa does so well, which is leapfrog. Just then leave everybody.
We're looking forward to that. Well, CAdHSI, we should say, is also engaged locally, right here in Baltimore, and in the United States. We're looking for partnerships, and we're looking to make a difference in health systems, innovations in communities that are underserved, for example. So yes, Africa, absolutely. My home country, Liberia, I'm looking forward to the changes and the innovations that we will of impact. But it's good to see that those same skill sets can be brought to bear in a local community right where we started, right here.
Which is wonderful. And to have that feeling of making a difference to one's local community, to being able to help make that transformation happen, to develop the trust, because trust is really important. And for the local stakeholders to say, hey, and maybe that might give them also give CAdHSI and perhaps even the local stakeholders an interest in seeing those methods adapted and used elsewhere.
You may have already touched on this, but maybe I'll ask it even more specifically. In the next 3 to 5 years, where do you see the biggest opportunities for an organization like CAdHSI?
So you're right. One of those was AI, harnessing the potential of AI. Another is building on a solid base in Africa and locally, as you said, building here, because there are many communities here that are not necessarily being served by local or state or national government structures, and they need it. I come from a country where government is more for the people than in this country. I'm Canadian, so I have a slightly different perspective on health systems than somebody who's lived in this country all their lives. For me, government has a different role to play. It's more involved, and healthcare is. Anyway, I don't want to go too much into this, but healthcare is considered something that everybody has a right to access it. It doesn't matter whether or not you have a job, doesn't matter whether or not you have insurance, because there is government provided insurance. There's a national structure. in the absence of that, groups like CAdHSI can make such a difference in the lives of real people locally. So those connections that are made, maybe just because it's somebody's, it might be your neighbor, or it might be somebody who there's a connection made through school. Might be because it's a connection made through Johns Hopkins. So huge potential to make a difference right here in Baltimore, in the broader Washington metropolitan area. There's a lot to be done, and generating results is the first way to convince somebody. It's maybe not all. Like I said, trust is really important, and often reaching communities that have been underserved, it's important to focus on that trust because they've been abandoned, left to their own devices. And when somebody comes in and says, I want to help you, their experience has taught them to be wary.
I understand. So if you're listening to this and you want to partner with CAdHSI, we would love to hear from you. If you're listening to this and you feel that you could benefit from our services, maybe there's something that we can do with you. And thank you so much, Nicola, for all the wonderful comments that you've made that I think have been very, very educational for anyone listening. Is there anything that you think should be a major takeaway for our listeners to this particular episode of the podcast?
Well, I'm actually realizing there were a couple more points that I wanted to make that I missed, and that was the importance of youth. Okay. That CAdHSI can also. So sorry about that.
Please, no, go ahead.
So CAdHSI can also, I think, because this is a group of fairly young people, mm-hmm. myself notwithstanding, and this is the way to the future, is working with young people, inspiring young people, and helping them to chart their own futures. So I think that's a really important area.
I'm glad you brought that up because that is important.
Yeah. I mean, we've got to be thinking about the next generations. And so folks who are at my age with the white hair, I think we very much need to be thinking about how can we do things in a way that's going to pave the way for young people who are going to be doing this work in the future. They're the ones who are going to be making a difference in the future. So as for other takeaways, I'm just really impressed at the dedication, the way that Ambalai in particular has brought together a wonderful group of people who are very committed to this. It's a cause, mm-hmm. and his drive to achieve results. This is what it takes. It takes Absolutely. That drive, and it takes also that willingness to learn mm-hmm. and to continue to learn. So hats off to him. He is one of those future leaders who I would very much like to support. A person
that is very focused and has gathered around him excellent mentors like yourself, like the chair of the board, Bill Brieger. So many people that he's gathered together. Yeah. I'm happy to be a part of the team.
And that's important too. He's creating this atmosphere where we are happy to be part of it. And for me, I'm at a stage where I do have a choice, and mm-hmm. I'm choosing to stick with CAdHSI for now.
Excellent.
I believe in the mission.
So good to hear. So good to hear. Are there any final comments that come to mind? Just anything at all that you want to throw out there that we might not have asked about? What excites you the most about this mission in terms of your personal feelings?
So for me, it is seeing a startup like this grow, make a difference in Africa, make a difference here with young people. I also wanted to do a plug for the communications function, not because you and I are talking, but because for me, communications is integral to any kind of successful endeavor, any kind, especially development work. And the way that communications has been incorporated into CAdHSI's work, I'm very happy to see that. And I think that we should continue doing that and do even more of it, because that's often the way that we're going to reach people. We're going to reach them through results, yes, through the technical work, yes. But sometimes techno speak can in the limit, it can turn people off. But reaching people by really communicating to them, reaching them, not just their brains, but their hearts, and their guts. That's important.
Well, thank you for that plug for communications. And I find that you are a wonderful communicator, and I'm very grateful that you are a part of this team. I'm grateful to the listeners to this podcast. I would like to thank you, Nicola Dyer, for coming and sharing your experience and sharing your contributions with CAdHSI with the audience here. I'd like to thank you, our audience, for listening, and be in touch with us. Go to our website, www.CAdHSI.org, and look for us on social media as well. We're CAdHSI, and we'd love to hear from you. Thank you.